Even though 500,000 Kentuckians use it to buy insurance, the future of the state's health insurance exchange is uncertain. The two leading candidates for governor have different views on whether they will kill the program. And the same goes for expanding Medicaid. New at 6, Mark Barber talks to the candidates about health care.
I am watching it very closely, knowing what's on the line.
All eyes in the healthcare industry are tied to the governor's race.
I'm very concerned.
Health Secretary Audrey Haynes says she's concerned because in only 5 days, the next governor will be elected and everything about Kentucky's health insurance could change. One thing is certain, federal funding for the expansion of Medicaid and Kynect, the state's health exchange, where about 500,000 people buy health insurance, is drying up soon. The federal dollars that were poured into Kynect are ending at the end of the year.
I'm just going to lift up your shirt.
The state is picking up the tab, which amounts to about $28 million a year.
In terms of the impact of the fee for operating the exchange, I think that would be a very negligible impact on the overall premium rates.
Dr. Glenn Mays studies the impact of health policies for the University of Kentucky. He doesn't think the $28 million hike will affect premiums because insurance providers will absorb the blow. Democrat Jack Conway and Republican Matt Bevin, the two frontrunners in the governor's race, have very different ideas about what comes next for Kynect.
Well, I do support keeping Kynect. I think it's been a national model. It's paying for itself by a 1% fee that's on the insurers that was already in place. We're doing it efficiently.
Bevin says he would dismantle the state's exchange because Kentucky is already paying for the federal exchange.
Starting in 2016, those folks who are enrolled through the Kynect exchange will, during that re-enrollment process, re-enroll on the federal exchange, where they can get the very same thing.
Hey there, I'm all done.
Kentucky's planned Medicaid expansion is also hanging in the balance of the governor's election. There is a hefty price tag tacked onto the expansion because the state will have to start paying for a greater share of the program because the government is decreasing their spending starting in 2017. At first, we will have to pay $74 million a year, but the cost will skyrocket to $257 million a year by 2021. Conway would expand Medicaid. He thinks the program will pay for itself.
Governor Beshear commissioned a study. It was done by Deloitte that took a look at the increased economic activity in and around Kynect and the expansion of Medicaid and having more people covered by health insurance. And they saw over 6 years tens of billions of dollars in additional revenue, thousands of new jobs created.
That is the most bogus study.
Bevin would not expand Medicaid. Instead, he would ask the federal agency that disperses Medicaid dollars to convert Medicaid into a block grant.
That block grant then allows us to use the same amount of monies that would have been dispersed, 70-30, 90-10, however it was that they were going to come to us. Those same dollars would be given to us to customize a program that allows us as a state to better provide health care.
In Frankfort, Mark Barber, WKYT.
Governor Beshear said it would cost the state about $25 million to dismantle Kynect. Matt Bevin said he thought the cost to shut the program down would be small.